Dr. Courtney Jaycox. I am a dentist and I'll be stationed at the Pearland location. My experience in dentistry is that I've been practicing for 10 years. I've worked in practice environments that were corporate dentistry, private practice, and even public health. I've even done humanitarian work where I've gone out and for nonprofit reasons internationally provided dental services to those in need. I became a dentist because I always knew I wanted to be a part of healthcare, specifically oral healthcare, because that's an area of healthcare that's often underserved. I wanted to be a voice in regards to the awareness of the importance of good oral health and how that affects your overall health. What I love most about my job is interacting with my patients. I get to meet people from vast areas of life. I get to connect with individuals and not just help them from an oral health perspective, but I can help them from a total body as well as mental perspective as well.
We are more than healthcare, we're whole person care. MyCHN.
I'm Sherilyn Littles. I am a behavioral health therapist and I am located at our League City clinic. My experience doing therapy ranges from a wide variety of topics, such as trauma, clients that have been a victim of domestic violence, sexual abuse. I've also done work with family counseling, couples counseling, and then I also help clients with anxiety, depression, life transitions, even college or career counseling as well. I became a therapist for representation, but also to help someone going through multiple things in their life to be a safe person that they could open up to, not be judged, but feel heard, supported, and validated. What I love most about my job is when my clients are able to see measurable outcomes in their lives. I think it's such a rewarding feeling when you're able to see your own growth and change.
We are more than healthcare, we're whole person care. MyCHN.
I am Dr. Sherry Jackson. I'm a general pediatrician, board certified, and I'm also the pediatrics director here at Community Health Network. I've been a pediatrician for nearly 20 years. I've been in a variety of settings. I've been in the hospital, in the clinics, in the Army, in private practice. I've worked in the suburbs. I've worked in rural areas. I did my training here in Texas, but then I left here and I moved and lived and worked in several different states having to do with my training and family obligations. But then I came back here a few years ago and I've been here at Community Health Network ever since. What I love most about my job is the time spent with families or connecting with families and helping them to help their children grow up healthy and strong. It is really difficult, when children are sick and parents are not sure what's going on, and so I get a deep satisfaction trying to help them figure out what's not working, what's not going well, and I love to see, the children's smiles and the parents' relief on their faces when they come back and see me and they're doing better than they were before.
Hi, my name is Margaret Hazelton. I'm a PA or physician assistant here at Community Health Network. I'm stationed at our League City location. My experience here as a provider has been very fulfilling. I truly enjoy what I do. I enjoy the team that I work with, and I enjoy the patients that I see. My experience has been very short because I graduated a couple years ago from school, but I have definitely enjoyed learning, seeing patients, being able to get a history, a physical exam, ordering tests, diagnosing and treating. I truly enjoy being able to help my patients. I also just enjoy that I have a team who works with me and backs me up when I need more assistance. Truly, the experience has been very, very wonderful. I became a physician assistant for many reasons. Obviously, I love being able to help people, and I saw being a PA as a way to help close that gap of the need for primary care providers. I love being able to be a part of my patients' lives in a medical way, getting them to where they need to be or being able to treat them. I also really love the preventative care aspect, so I like being able to get them to a point where they're not needing this medication anymore, or where they understand their health a little bit better, because healthcare isn't always accessible to everyone. So it's nice to be able to give them that adequate healthcare that they might not otherwise have. What I love most about my job, that's kind of a tough question, because I love what I do. I love my patients, I love my team, and I love overall Community Health Network and the mission of this clinic. I think if I had to choose what I love the most, it would definitely be patient care. I always knew coming out of school that I was going to work in an underserved population and work with people who might not have access to healthcare otherwise. I truly love being able to see patients and kind of get them comfortable with coming to a provider, seeing me and feeling safe talking to me. Sometimes patients aren't always okay going to the doctor, or they don't like going to the doctor for one reason or another. So I like that I can give them that comfortability to be okay coming here. I truly love putting a smile on their face before they leave the room and making sure that all their concerns and questions have been answered. I just love the patient care part of being a provider, and I love being able to give them something that I know they might not have elsewhere.